Hi, Dr. Bosem. We are going to talk about EVO ICL. Can you give us a little bit more information about what is EVO ICL?
Everybody knows what LASIK surgery is, and LASIK surgery is a surgery that corrects vision. But now EVO, which means evolutionary, is a new type of refractive surgery or vision correction surgery that allows people to see really clear, correct their vision, rid themselves of glasses, and do this without changing the shape of the cornea or taking away tissue.
Dr. Bosem, who is a candidate for EVO ICL?
EVO ICL has the greatest range of vision correction. One can be from about -2.5 all the way up to -16 and higher, with up to 4 units of astigmatism.
What are the potential benefits of EVO ICL?
EVO ICL, by not changing the shape of the cornea, can give really good visual quality, something that sometimes is even better than some of the other technologies that we use.
What are the potential risks and side effects of EVO ICL?
EVO is, in some respects, less invasive than other procedures like LASIK and PRK and SMILE, but all surgeries have risks and benefits. As far as EVO risks, there are small risks for getting a cataract later in life, and you could have bleeding or infection, but they're very, very rare.
What is the recovery like?
I just saw today 2 people that had EVO lenses implanted in both eyes. One of the patients was 20 years old. He had a prescription of -14 with 4 units of astigmatism. And on day 1 after surgery, he's seeing 20/20 with normal pressure and is going about his life as normal. And the other one is about 30 years old, was about -10 with 1 unit of astigmatism, and very similar. She was already better than 20/20 in each eye. So very quick recovery, very similar to LASIK as far as time from getting fixed till time that you can see perfectly.
What should a patient expect during the procedure?
Essentially, you might just feel a little bit of pressure. There'll be some light shined in the eye, and the lens is put right behind the colored part of the eye called the iris, and right in front of the natural lens. Each lens is custom fit to the person having the procedure.
Is EVO ICL painful?
There's no pain involved in EVO ICL.
Can others see the EVO ICL?
If somebody has a microscope looking right into the eye, you can see that there is a lens there. Otherwise, from a distance that most people are looking at one another, you cannot tell somebody had EVO.
How long does the EVO ICL last?
The EVO is a Collamer intraocular lens, which means it's a lens made out of a Collamer material. Collamer means copolymer, and it's made out of a biocompatible material that can stay in the eye your whole life. Even though the EVO surgery is one of the most wonderful types of corrections that have come out, the EVO cannot be done on everybody. And the only way that we can decide which surgery is best for you is to come in for a personalized consultation. Today at Correct Vision Laser Institute, we perform surgery on 6 different types of procedures. And these 6 different types of procedures are individually tailored to each person. Now, one person might be available to have 1, 2, 3, or 4 of those 6, but in most cases, one procedure is best for the individual. And the only way to figure out which procedure is best for you is for us to do a 20-point examination, including multiple modalities of diagnostic tests, and figure out which type of procedure is going to fit to each person the best. And that's what we do here at Correct Vision Laser Institute, is find the best procedure for each person so we have happy patients.